So for mefloquine, yes, pediatrics can take, but once your weight is below 5 kg, stay away. Please stay away. It's not recommended for those below 5 kg. Above 5 kg, if you're in pediatrics, then you can take 5 milligram per your kilogram body weight once every week. So you pick one day. If it's every Sunday, then you take it around same time. Adults may take 250 milligram same once a day. But once you mention mefloquine, do not forget psychiatric issues, because it has the potential to cause these CNS problems. And therefore, if you have any of such issues, please stay away from mefloquine, psychiatric issues. The good thing is that a pregnant woman who is a burger can take this medicine. So if you're a burger pregnant coming without any psychiatric issues or any other contraindications to mefloquine, then that is the best option for you. Below 5 kg as a child, stay away. If you're above, you can take. Normal adult, you can take. Take it 2 to 3 weeks before you come. When you are in Ghana, you take it once every week. When you return back to your state, US, whatever, continue once a week for 4 weeks. Continue once a week for 4 weeks. Note that all these are to protect you from getting the malaria, but none is 100%. None is 100%. Doxy, mefloquine, Malarone, which is atovaquone plus proguanil. None of them is 100%. And for that matter, apart from taking these drugs, you have to make sure that you observe all the strategies when it comes to prevention of bite. You could get a virulent parasite, even in the presence of this chemotherapeutic agent. They will overcome the chemotherapeutic agent and still establish the case of malaria. These are vulnerable individuals. And when they get malaria, it could be the severe type. So make sure that in addition to these chemoprophylaxis, you observe prevention of bite strategies. You don't say that Ghana is hot, so nighttime you move out between dawn and dusk with shorts, only shorts, nothing on you. You go and stay outside, you'll be bitten by mosquitoes, and unfortunately you may get malaria. Any queries? Herbal preparations, we've spoken about herbal preparations and the contraindications. Again, it just is to remind you that it is part of the new recommendations since 2023 February. If you want to take any anti-malaria for herbal, those herbals that are described as anti-malarials, then of course, the mixture should contain at least one of these agents or more. So you look at some of them, they contain about 3 or 4 of these agents. Others will contain 1, others will contain 2. But if you are below 12 years, no. If you are pregnant, no. If you are breastfeeding, no. If you have or they isolate P. vivax or P. ovale, the herbals are not able to get into the liver and kill those parasites. And therefore, in P. vivax and P. ovale malaria, the herbals will not help you. So these are the agents. Any queries? Any queries? So now, the program also wants to enroll this new strategy of chemo prevention from this year to 2028. They are yet to confirm, but that is part of their plans. So chemo preventive interventions. One of them is the intermittent preventive treatment of malaria in school children. So that is one of the things that they want to do. So all school children, so they want to target areas where you have high levels of malaria. So they want to enroll this. You do intermittent preventive therapy, for example, like the seasonal malaria chemoprophylaxis strategy. in school children. And then those who will get malaria, severe ones, right after your discharge, then they give you these anti-malarials that contains a long-acting agent. For example, like Diatem, DHAP, dihydroartemisinin piperaquine, to help prevent further cause, because that one can give you long-term protection. Piperaquine can stay in the body for at least 28 days. So that one can help you. Then the third one is the mass drug administration. So every eligible person within a given geographical area will also be given anti-malarials. Sorry to say, some of the areas like the Zongo communities have a lot of choke gutters and what have you. The Zongo communities, for example, will be one of the candidates for this mass drug administration.
That's one thing I've seen. But when you ask the mother, why is it?
But Captain, can you please mute the person talking? All right. Hello. Hello.
Hello.
All right. So these are possible strategies that they hope to roll them out. And it's expected that they will start from this year and then test it until 2028 and then see. Now, we've been talking about new additions. So this slide is trying to summarize all the new additions. So you may decide not to look at this slide at all, but this last slide, please note, because if any question will come on the new recommendations, you have it on this slide. So the first one is the first line treatment options. You remember the multiple first line therapy. That is one of the new recommendations, including the enrollment of artesunate pioneridine. So note that they've added artesunate pioneridine, and of course, it will be part of the multiple choice for first line. So that's a new agent or new combination added. And if you are taking anti-malarials nowadays for uncomplicated malaria, remember that there is something called multiple first line therapy. It was part of the new recommendations. Previously, ACT use could only be done after first trimester, that is in pregnancy. Currently, ACTs can be used in first trimester. Remember the addition of the low-dose primaquine in the so-called low transmission areas to try and clear the gametocytes. Remember primaquine. Then remember that the primaquine that we used to do for Vivax and Ovale malaria, the duration of therapy used to be 14 days for those who were taking 0.5. That is the full defect individuals. The duration was 14 days. Now they have reduced it to 7 days. So note, if you are giving primaquine for radical cure, now the duration is no more 14 days. It has been reduced to 7 days. Previously, herbal medications were not considered by the malaria policy. Nowadays, herbal medications are considered. But remember that it should contain at least one of the recommended agents, cryptolepis and what have you. Then, previously, when you treat your severe malaria with artesunate IV, there was no option like, should in case it fails, what do? That recommendation wasn't there. But currently, if you treat your complicated malaria with artesunate injection and it fails, you go back and do a combination of artesunate injection and quinine injection, both at full recommended doses. Artesunate, depending on the weight, if you are above 20 kg, you are taking 2.4 milligram per kilogram body weight. If you are below 20 kg, you are doing 3.0 milligram per kilogram body weight. Quinine, you are doing 10 milligram per kilogram body weight, 8 hourly, 7 days. Artesunate, if the person doesn't improve, remember you are doing the first 3 doses, times 0, times 12, times 24 hours from times 0, and you are going to take it a dose per every 24 hours for 7 days. So that is the intervention for treatment failure with IV artesunate. Any queries?
Hello.
Yeah, hello.
So there's a formulation. So with the reconstitution of artesunate, there's sodium bicarbonate, but there's a formulation called Ageson. I don't know if I have the name right, but it contains argonic acid. So I wanted to know the
And
essence
what?
of argonic
Argonic acid and what?
sodium bicarbonate.
Plus artesunate.
Yes.
In fact, I've not come across that product before. Is it used in the hospital? Which hospital?
Yes. UGMC.
Really?
Yes,
I
I think
don't
it's a
know.
relatively new formulation, but I don't know
So it's basically
relevance of.
artesunate that is in there.
Yes, but with the sodium bicarbonate, it has argonic acid
Instead,
plus argonic acid plus sodium bicarbonate.
without normal saline.
So you do that reconstitution before you add it to the normal saline. So I
Oh,
don't know the
okay.
essence, but
So
I
now
know
you are now doing the artesunate acid plus bicarbonate plus argonic acid.
yes,
Then you dilute.
yes.
Okay. All right. I have not come across that product.
Oh,
But what
okay.
is the literature saying?
It
The
says that
product
the
leaflet.
argonic acid helps with the solubilization, but I don't know if it has any other relevance. So I wanted to
Okay.
find.
Okay. So, but without that one, the bicarbonate is also able to solubilize it. Oh, so they
Yes.
want to make sure that it is fully dissolved. So they are now using two agents to ensure solubility. Okay. All right. Thank you. I'll search for that. I've not come across that product though.
Okay.
So I'll search for that.
Thank you.
Any other question? You're welcome. Any other
Yes,
question? Class captain. Yeah,
please I
hello.
have a question. Yeah, for the seasonal malaria chemo prevention, you said that for SP you give it once every month,
Yes.
and then for the amodiaquine, you said you give it daily for 3 consecutive days. Is it that one
Yeah.
too? You do that for every month?
Yes. So that's the combination. You are doing amodiaquine plus SP. SP is taken once. That is the full course. The full course of SP is once at a time. But amodiaquine, the full course is either you take it the recommended daily dose, you take it once a day or in 2 divided doses for 3 consecutive days. You get it? So every month you'll be doing the 2 SP once. That is the full course. Amodiaquine, the full course is 3 days. Either the dose that the patient requires will be taken at once, or you divide it into 2 and make it BD for that 3 days. So this month you do that. Next month you do that. The following month. So for that 4 months stretch, you repeat same. Are you okay?
Yes, please. Thank you.
Okay. Any other question? Last question.
Sir,
Yeah, hello.
yes, sir, please. I don't know whether you made mention of the ideal anti-malaria for HIV patients because last week I had issues with my network.
Oh, HIV can take artesunate. Why not?
Okay.
So they are part. They are part of the main group. In fact, they are not classified as vulnerable when it comes to, but though they have compromised immunity, but they are not part. We don't consider them as part of the vulnerable group. Else, they would have been mentioned in the vulnerable group category, but they are not there. But they can take the normal drugs that everybody takes. Not forgetting the potential drug interactions. Because of our malaria class, let's stretch for about 5-10 minutes, then we switch to at least the introduction of the next infectious condition, enteric fever, that is typhoid. We can use at least the next 5-10 minutes to stretch and start the introduction to typhoid fever. Last week, I had a call from one of your parents recommending to us that the 3 hours stretch is too long, and therefore we should have intermittent breaks. I forgot to inform my class captains, but we had a call like that. I don't remember the person, but one of your parents did call and said, oh, there are issues. Some of them are having some neck pains and what have you. And of course, you write your own stuff. So doing the whole thing like straightforward 3 hours is too stressful. So we should be breaking at least every hour. We give you 5 minutes break. I said, okay, fine. We will consider that. So we are switching to enteric fever. So let's, class captain, your suggestion, how many minutes?
Please, 10 minutes.
10 minutes. So please let me know when the 10 minutes is over. Let me try and then switch over to enteric fever.